Lung volumes and lung capacities refer to the volume of air associated with different phases of the respiratory cycle. Lung volumes are directly measured. Lung capacities are inferred from lung volumes. The average total lung capacity of an adult human male is about 6 liters of air, but only a small amount of this capacity is used during normal breathing. Tidal breathing is normal. Resting breathing. The tidal volume is the volume of air that is inhaled or exhaled in only a single such breath. The average human respiratory rate is 30 to 60 breaths per minute at birth, decreasing to 12 to 20 breaths per minute in adults. Factors affecting volumes. Several factors affect lung volumes. Some can be controlled and some cannot. Lung volumes vary with different people as follows. A person who is born and lives at sea level will develop a slightly smaller lung capacity than a person who spends their life at a high altitude. This is because the partial pressure of oxygen is lower at higher altitude, which, as a result, means that oxygen less readily diffuses into the bloodstream. In response to higher altitude, the body's diffusing capacity increases in order to process more air. When someone living at or near sea level travels to locations at high altitudes, that person can develop a condition called altitude sickness because their lungs remove adequate amounts of carbon dioxide, but they do not take in enough oxygen. Specific changes in lung volumes also occur during pregnancy. Functional residual capacity drops 18 to 20%, typically falling from 1.7 to 1.35 liters, due to the compression of the diaphragm by the uterus. The compression also causes a decreased total lung capacity by 5% and decreased expiratory reserve volume by 20%. Tidal volume increases by 30 to 40%, from 0.5 to 0.7 liters, and minute ventilation by 30 to 40%, giving an increase in pulmonary ventilation. This is necessary to meet the increased oxygen requirement of the body, which reaches 50 milliliters per minute, 20 milliliters of which goes to reproductive tissues. Overall, the net change in maximum breathing capacity is zero. Values. The tidal volume, vital capacity, inspiratory capacity and expiratory reserve volume can be measured directly with a spirometer. These are the basic elements of a ventilatory pulmonary function test. Determination of the residual volume is more difficult as it is impossible to completely breathe out. Therefore, measurement of the residual volume has to be done via indirect methods such as radiographic planimetry, body plethysmography, closed-circuit dilution and nitrogen washout. In absence of such, estimates of residual volume have been prepared as a proportion of body mass for infants, or as a proportion of vital capacity, or in relation to height and age, liters for normal mass individuals and liters for overweight individuals. Standard errors in prediction equations for residual volume have been measured at 579 milliliters for men and 355 milliliters for women, while the use of 0.24 FVC gave a standard error of 318 milliliters. Online calculators are available that can compute predicted lung volumes, and other spirometric parameters based on a patient's age, height, weight, and ethnic origin for many reference sources. Restrictive and obstructive. The results can be used to distinguish between restrictive and obstructive pulmonary diseases.